Let's talk about pain, chronic pain. In Germany, there are 12 to 15 million people suffering from chronic pain. In the United States, due to the high number of people living there, it should be 3 times as much, I guess. So the medical model of pain considers pain mainly as a solely physical process, but this model cannot explain the removal of pain by hypnotic suggestions. It cannot explain phantom limb pain. It cannot explain the persistence of pain after a surgical the surgeon cuts the nerve. So, what is your model of pain? How pain? What's your concept of pain, especially chronic pain?
Well, stated in one word, it's psychogenic. See, pain, and there's certain kind of hard things about pain. First, it's always real to the person in pain. Doesn't matter whether it's imagined or organically inspired, it's real.
He
to the
feels
person.
it.
The next essential point to recognize is that pain is all about perception. And we know we can modify perception by hypnotic influence. The other essential feature is that pain always serves a purpose. A purpose. Yeah. And that purpose may be something recognized consciously but ignored, but most often that purpose is not recognized consciously.
You're talking of chronic pain right now.
Yes, I'm talking about chronic pain. I'm not talking about acute pain. I'm talking about chronic now. For acute pain, the purpose is, something's broken. Go get it fixed. Get that tooth taken care of, whatever it is. But when the tooth is taken care of and the leg is in a cast or whatever medical procedure is required, at that point, the pain no longer serves purpose. And then it's possible to exercise this capacity that all animals, including humans, all animals have. And that is the ability to not perceive pain. That's not popularly recognized, but it is true, absolutely true. There are many spontaneous demonstrations of that from severe wartime trauma and acts of heroism under conditions that how could you possibly explain that, to minor things like little injury around the house with some blood, and you don't know, you have to look to see where it's coming from. Many instances of this. And here's the other side of the coin that's also very significant. And that is, not only can we not perceive pain, we can mentally create it when there is no physical basis.
And this is what's happening in chronic pain patients.
And that's what goes on, yes. Now there may be some medical condition. Maybe they've had a spinal fusion or something like that. Well, the medical condition is fixed. What's the purpose of the pain? There's no neural stimulation, and yet it can persist for a lifetime. So by guiding the patient to use that higher ability syndrome to identify this hidden, unrecognized influence that's perpetuating the experience of pain. You know, this is all kind of mysterious, but you see this common theme applies to all psychogenic problems. It's as though the problem it persists for reasons that were valid, real, when it began. But these reasons no longer make sense. They don't apply anymore. But some part of the person's mind, it seems like that part is ignorant of present life. It's just functioning on the basis of what was. And it's necessary to identify that part, recondition that part. Well, the patient can't do that consciously, but by tapping into Centrum, they can't do it.